Assalamu alaikum. Welcome to my Taseer Gynaecological department. I'm Dr. Komal Parvez and belong to a medical profession, and my goal is to share knowledge with all of you. Whether you are a medical student or someone wanting to learn about the women health, so don't forget to subscribe to the channel and press the bell icon to get notified every time I upload the new video. Audience, let's begin today's topic. Today we are going to discuss a very common yet often underdiagnosed condition in gynecology, that is dysmenorrhea or painful menstruation. So audience, first I'll definitely define what is dysmenorrhea. Dysmenorrhea, it is not only affect physical health but also impact mental well-being and quality of life. So audience, do you think dysmenorrhea is curable? Let's understand it is curable or not, what it is, what it happened, how we manage it. Audience, absolutely yes, it is curable. Here the proper explanation of dysmenorrhea. Basically, it is painful uterine cramps associated with menstruation. The pain usually begins just before or at the onset of menstruation and may last for 1 to 3 days. It is typically located in the lower abdomen and may radiate to the back and thighs. Audience, now I'll tell you about the classification of dysmenorrhea. Audience, do you know about the classification of dysmenorrhea? Okay, let me. Here it is. Dysmenorrhea is broadly classified into two types: primary dysmenorrhea and secondary dysmenorrhea. First, I'll explain primary dysmenorrhea. Occur in the absence of underlying pelvic pathology. Most common in adolescents and young women, especially 1 to 2 years after menarche, usually linked to ovulatory cycle. Secondary dysmenorrhea caused by identifiable gynecological disorders such as endometriosis, uterine fibroids, leiomyomas, and pelvic inflammatory diseases, adenomyosis, intrauterine devices. In some cases, it typically starts later in life and may worsen over time. Now we will discuss about the etiology of dysmenorrhea. Let's first talk about primary dysmenorrhea. The primary mechanism involves increased production of endometrial prostaglandins, particularly PGF2 alpha, during the luteal phase of menstrual cycle. These prostaglandins cause vasoconstriction and myometrial contractions, resulting in ischemia and pain. Other contributing factors include high level of vasopressin, decreased uterine blood flow, elevated leukotrienes, and inflammatory mediators. Audience, what do you think? Why dysmenorrhea happens? Why? Okay, I'll describe the causes of secondary dysmenorrhea depends on these diseases. Endometriosis causes pain due to ectopic endometrial tissue. Fibroid causes increased uterine pressure. Adenomyosis lead to bulky, tender uterus. PID, pelvic inflammatory diseases, cause chronic inflammation and adherence. Okay, here we go for the risk factor. Risk factors for dysmenorrhea including early menarche before age 12, heavy prolonged menstruation, flow smoking, stress anxiety, and nulliparity. Wait a minute, guys, do you know what is nulliparity? If you do, let me know in your comments. Family history of dysmenorrhea? No. We will discuss about the clinical features of dysmenorrhea, including cramping in your lower abdomen, and pain may radiate to the lower back and inner thighs. Onset typically occur just before or at the start of menstruation. May be accompanied by nausea and vomiting, diarrhea and constipation, headache and fatigue, dizziness or fainting. And in secondary dysmenorrhea, pain may begin before the periods or continue even after it ends. Be non-cyclic or present during intercourse. Dyspareunia. Okay, audience, here we reached on diagnosis of dysmenorrhea. Diagnosis. Primary dysmenorrhea is diagnosed clinically based on detailed menstrual pain history, normal pelvic examination in sexually active patients. Secondary dysmenorrhea warrants further evaluation, especially if pain starts later in life, pain in progressively worsening. There are abnormal bleeding patterns. Now I'll discuss the investigation, including pelvic ultrasound to detect the fibroids or ovarian cyst, etc. Laparoscopy, gold standard for diagnosing endometriosis. MRI in suspected adenomyosis. Endometrial biopsy if abnormal bleeding is present. Here we will discuss about the treatment and management of dysmenorrhea. Primary dysmenorrhea, you should visit the Taseer Gynaecological new department because we have the herbal treatment which gives the 100% recovery from dysmenorrhea. My dear patients, you can also go for the non-pharmacological measures for primary dysmenorrhea. For example, heat therapy, regular aerobic exercises, yoga, acupuncture, relaxation techniques, educate sleep and hydration. Secondary dysmenorrhea treat the underlying causes, surgery for fibroids or endometriosis, herbal medicines for PID, hormonal suppression in endometriosis, hysteroscopy in severe unresponsive case, last resort. Here my counseling and patient education to my dear audience. My patients and my dear students, patient reassurance is extremely important. Let your patient know that primary dysmenorrhea is common and treatable. Each treatment leads to better control of symptoms. Encourage open discussion about the menstrual pain, especially in adolescents. Educate about the red flags that indicate the secondary causes. Always personalize the management based on the age, fertility desires, severity of symptoms. So this is all today's topic. Thank you so much for watching. I truly hope this video helps you understand women health a little better today. If you found this valuable, don't forget to like, don't forget to share and subscribe to the channel, and yeah, comments below your questions. Also click the bell icon so you don't miss the next video in our gynecology series. See you again in the next video with informative topic. Until next time, stay healthy, stay informed, stay empowered. Bye bye.